Hi, my name is Courtney Koren, and I'm a certified nuclear medicine technologist. I've been a nuclear medicine technologist for 18 years. Today I'm going to be giving an informative presentation on PET-CT scans. A PET-CT scan is an imaging test used in diagnosing cancer. At the end of my presentation, I hope that I will have given you enough information to put your mind at ease that if you or a family member are faced with a PET scan, you will feel more comfortable. Let me start by telling you what PET-CT stands for. PET stands for positron emission tomography. This is a type of imaging that uses a radioactive injection to look at cellular metabolism. CT, or CAT scan, stands for computed tomography or computed axial tomography. These mean the same thing and they're used interchangeably. A CT scan is a test that uses X-rays to look at the structure of the body and the anatomy of the body. There are three indications used in PET-CT scan: oncology for cancer, neurology for the brain, and cardiology for the heart. For the purpose of my presentation, we'll be focusing on oncology because I believe that everybody has been affected by cancer in some way. There are three stages to a PET scan. A PET scan takes about 2 to 2.5 hours, and it involves a preparation and injection stage, the circulation of radioactive glucose stage, and the imaging stage. I'd like to introduce Marka, who is my colleague. She's going to be our patient for the purpose of this presentation. The first thing the technologist does is make sure that the patient has followed the preparation instruction of not having anything to eat or drink in the last 4 hours. It's very important that they follow these directions. If a patient has had anything to eat or drink, it could affect the accuracy of the test. It can make the body process what they have had to eat instead of the injection that we're using to look for cancer. The first thing we do is check the blood glucose level. That's done by doing a finger stick. We need to make sure that the blood glucose level is low enough to be able to do the test. If their blood sugar is too high, then the small amount of radioactive injection that we'll be using will be competing with what's already in their body. So once we verify the blood glucose level is low enough, I'll administer the radioactive injection. This is given through an intravenous line that goes into the bloodstream. The circulation does not hurt or burn. All they have to do is recline back, take a nap if they want, read a magazine, but most importantly is that they relax. Patient has to sit in the room for 60 minutes before we take the pictures. That gives the body enough time to process the injection. Normal cells will use the injection and get rid of it, but it gets trapped in any tumor cells. The third and final stage is the imaging. For the scan, the patient will be laying on their back with their arms above their head. This is important that they have their arms up because we're able to see the lymph nodes a little bit better underneath of the arms. We try to make them as comfortable as possible by putting a nice cushion underneath of their knees. Most people fall asleep during their pictures. There's very minimal breathing instructions. A lot of people don't have a problem at all. If you are claustrophobic, you should ask your doctor to prescribe an anti-anxiety medication that will help with any problems that you have laying inside the scanner. The scan takes about 30 minutes. We'll be imaging from the eyes to the middle of the thighs. That takes about 20-25 minutes. Then we'll go back and do the brain, which takes about 5 minutes. Once the scan is complete, the patient is free to discharge with no extra precautions. The radiologist will interpret the reading and give the ordering physician the results. That usually takes about 2 days. I'd like to show an image of a PET-CT scan. This image here is the CAT scan. For the most part, it looks pretty normal, except for this area right here. The CAT scan lets us see if something is abnormal, but it doesn't tell us exactly what it is. This is a PET scan image. This area that is dark, that is where the glucose has accumulated in those areas. That means that they are probably cancer. So when you put the CAT scan and the PET scan together, it's called a PET-CT scan, and it shows that in fact the abnormal area that showed up on the CAT scan is actually cancer. I'd like to end my presentation with answering the most common question that I get asked. Will I glow in the dark? The answer is no, you will not glow in the dark at the end of a PET CT scan. The radiation dose for a PET CT scan is equivalent to a chest x-ray. Thank you for your attention. If you have any questions, please feel free to contact me at ckoren75@yahoo.com. Thank you.